The overall complication rate with breast implants is fairly high. It's percent, and that's across a number of different issues. Until there is a better, safer option out there, patients are still going to choose breast implants because it's just the most available thing out there. For those reasons, I decided I would not do breast implant surgery anymore and focus on a safer, more natural alternative, which is using your own natural tissue, which is fat.
Super important podcast for you guys today. We've got Dr. Jon Kanevsky. He is a board-certified plastic and reconstructive surgeon in Los Angeles who has earned international recognition for his mastery of natural breast reconstruction and the holistic treatment of breast implant illness. He is widely regarded as one of the most trusted voices guiding women out of implant-related illness and back into their authentic, vibrant selves. Listen to this one. You're going to love it. And call a friend after this with implants because she needs to hear it too. Hi, guys, and welcome back to the Thick Thighs Save Lives podcast. I'm Rachel, and I have an amazing, amazing guest for you here today. Dr. Jon Kanevsky is a worldwide, beautifully accredited and so well-respected surgeon in Los Angeles that is doing some really incredible things in the field of both cosmetic surgery and you are a specialist in explant surgery. And I want to give you a chance to tell our listeners a little bit about yourself and what you are doing every day in your practice that is making a huge difference in many women's lives.
Thank you for having me on and for the chance to share some of my work, but also learn a little bit more about what your audience might be interested in. My work in breast surgery is focused on explant surgery, so removal of implants for women who have had either complications or issues with their implants, taking care of women who've had breast cancer for breast cancer reconstruction, and also cosmetic procedures for primary augmentation of the breast. And that's with a method that I've crafted over the past few years known as fat grafting. So really all things related to surgery of the breast and body, but a more holistic and natural approach by using your own natural tissues such as fat to shape and mold the breast.
This is so amazing and interesting to me, and I know it's going to be so interesting to our listeners. As you know, in the past, breast augmentation has been the choice of saline or silicone, kind of. That was your two choices. And over, so many years, we have seen that whatever version of we thought was the healthier choice have all sort of come with some complications in certain groups of people. So I want to give you a chance to talk a little bit about what you've seen in your practice with some of the women who have come to you for explant surgery. But also, I definitely want to hear more about the fat grafting.
Sure. So breast implant surgery has been around for a long time. The breast implant devices continuously evolve over the past few decades. The reason I say it like that is because although there has been a significant amount of money and research that's gone to changing the nature of the devices and the implants, the biology hasn't fundamentally changed, and the real substance of what an implant is made of hasn't really fundamentally changed either. It's still silicone in one shape or another, and it's still being placed into the body. When anytime something's put in the body, the immune system has a response to it. It creates a capsule. There's something known as the foreign body reaction. And the reason that I stopped using breast implants is because about a decade ago, I started to see more and more patients coming into my practice with concerns around their implants. This is right around the time that I was finishing fellowship and finishing my training. And there was also a lot more research as well as outspoken people in the media talking about issues with their breast implants. So patients were paying more and more attention to it. And the overall complication rate with breast implants is fairly high. It's 30%, and that's across a number of different issues. So there's
Wow.
nearly if not 100%, but nearly 100% of patients who get breast implants will require a second surgery at some point in their lifetime, either to adjust or
Right.
remove the implant. Complications with breast implants include anything from infection to bleeding around the implant, but the more common complications is something known as capsular contracture. So, that foreign body reaction, the capsule that forms around an implant, the body will create this wall of inflammation around it that's going to constrict and contract the implant, which can become painful and even it can also create some visible deformities around the breast. In addition to capsular contracture, there's something known as BIAALCL, that's breast implant associated anaplastic large cell lymphoma. So, a lot of words to say that there's a rare type of cancer, an immune system cancer that happens around implants. And the third thing, which has been more spoken about recently, is something known as breast implant illness, or SBII, systemic illness associated with breast implants. And that's more of a constellation of symptoms that fall into the autoimmune category. So things like joint pain, fatigue, dry eyes, hair loss, skin rashes, and a number of symptoms related to both mental health related and other categories in the endocrine systems. But basically, those three categories, capsular contracture, cancer, and breast implant illness, are what make up the majority of that 30% of complications associated with breast implants. And because of that, that's fairly high to think, oh, there's a 1 in 3 chance, especially if this is an elective cosmetic surgery procedure, that
Right.
that there may be a complication. For those reasons, I decided I would not do breast implant surgery anymore and focus on a safer, more natural alternative, which is using your own natural tissue, which is fat.
30% is blowing my mind right now. I've
Mhm.
never heard it in those terms. I had heard of each of those complications sort of separately in their own. And of course, with the category of autoimmune, sometimes it can be difficult to, or maybe people don't want to necessarily blame one thing or another thing, when when your body is having an autoimmune response, like
Mhm.
the blame of the breast implant being, kind of controversial. um but 30% is wild. I can't think of another. I mean, the most dangerous cosmetic procedure, correct me if I'm wrong, is currently, like, the Brazilian butt lift. Is it not?
It used to be. I'm not sure if it's
Okay.
still really as dangerous as it was. It certainly isn't as dangerous as it was because of refinements in the technique and the way that the data is reported. It was absolutely the most dangerous. So, with a significant mortality rate. It's much safer now. But as far as complications go, yeah, that's very high. Now, complications there's a wide range of what things are considered as complications, but
Okay,
those
okay.
aggregate. So if you take all the things that I mentioned and compile that over, that's 30%. Now, if
Wow.
certain surgical procedures and medical conditions warrant a higher complication rate, if it's for life threatening or if it's necessary, if it's
Sure.
joint replacement or heart surgery, we take on the risk, and everything in medicine is about assessing the risk and the benefit. And the best thing any doctor can do for their patients is give them as informed a decision as possible based on the information, or help them make the most informed decision possible based on the information. So that's a thorough discussion of the risks and a thorough discussion of the benefits, and help patients choose what's going to be the best outcome for them. For a cosmetic elective procedure, so arguably one that's not a medical necessity, but still important to somebody, it's not a
Sure.
heart surgery, it's not a joint replacement. That's extremely high. 30% is very high for something that's not a life-saving necessity. And for that reason, that's why I decided to no longer do breast implant surgery and focus my practice on removal of breast implants to help patients with any of the one of the issues that I mentioned, and focus on fat transfer as a solution, a safer solution for breast augmentation, knowing that until there is a better, safer option out there, women and patients are still going to choose breast implants because it's just the most available thing out there.
So tell me a little bit about the difference between enhancing your breasts via an implant of some of whatever material we're making of it right now,
Mhm.
or replacing some of the fat loss, or so like, are you able what are you able to do with fat grafting? Is it the same
Yeah.
as far as results?
So these are good questions, and my approach to plastic surgery is that every issue or thing that's trying to be solved requires an anatomic solution, meaning fix the thing that's actually causing the problem. And if a patient wants more volume in their breast, it's not because they have a lack of implant there, it's because they have a lack of, or there's not enough of the tissue that they would want to be there, which is breast tissue. And breast tissue is made up of breast gland and fat. So the most anatomic solution is to increase the volume of the breast with fat. Same thing after a lumpectomy or partial mastectomy. It's not that they don't have enough implant there; it's that
Right.
the breast tissue is removed. And the same goes for treating any either cosmetic or reconstructive part of the body. It's always about solving the problem with like tissue, taking tissue from one place to fix it and restore the problem with as much of the similar tissue as possible. What an implant does is it increases the projection and volume of the breast. So it's increasing the overall shape and projection of the breast. And more commonly, what implants do is they create fullness in the upper pole of the breast. So if the breast has a top half and a bottom half, it's increasing the fullness in the upper part of the breast. The surgery itself, though, I think is quite traumatic. So an implant is being placed usually underneath the muscle, and that's the pectoralis muscle. So that's a muscle that's necessary for pulling your body up and doing pull-ups. It's for opening doors. It's for closing things. I mean, think of all the things you use your chest muscles for. And so that muscle is disinserted, and the pectoralis muscle function is absolutely impacted. It's
Is
not,
it?
yeah. I mean, you're disinserting fibers of a muscle that's supposed to be there. People are still able to work out and function, but many patients develop something known as what's called an animation deformity. So that means the muscle is moving on top of the implant. So anytime they contract their pecs, the breast implant moves, and it can look kind of weird. The newer implants, the newer techniques are focused more on uh, placing the implant above the muscle, which at least is respecting the anatomy a little bit more, but it's still quite disruptive to put a foreign body implant over the muscle. Fat grafting is about restoring and increasing the natural volume and shape of the breast. So it's not going to dramatically change the shape of the breast, but it will increase your existing volume. It's still possible to really sculpt the way that the fat is sculpted. It's little drops of fat are placed throughout the breast like seeds in a sponge, as opposed to an implant, which is just taking up a lot of space.
Mhm.
Now, an implant or fat, it really depends on what the aesthetic goals are for the patient. Apart from all the other things that I said, if a patient was to come to me and say, this is really the look that I want to go up more than one cup size and, maybe two or three cup sizes larger, and I want the fullness and I want the shape and the cleavage in the top part of the breast, more likely an implant's going to be able to achieve that. In some cases, it is possible with fat grafting, but it does take more than one round of fat grafting. Fat
Okay.
grafting to the breast is like the tissue is like a sponge, so it can only hold so much fat before, like a sponge overfills with water. The same with fat grafting. So that first round of fat grafting, what it does is it helps lay the foundation, increase the volume of the breast, and the fat is like a regenerative tissue. It's full of stem cells that help increase the new development of blood vessels in the area. And so if a second round of fat transfer is done, it then helps more fat cells survive. So there's a lot of differences between fat and implants, but the overall goal is the same, which is to increase the shape and volume of the breast.
Now, the recovery, you mentioned, the under the muscle, and actually many people having like residual effects to that pectoral muscle being severed in some way or reconstructed. Um, what is the difference in recovery if someone were to elect for fat grafting, augmentation versus?
Great question. So the way that I do the fat transfer procedure is it's normally done under local anesthesia. So you're awake for the procedure, but very comfortable. So you don't have to recover from this heavy effects of general anesthesia. General anesthesia is when most of the complications that happen during surgery tend to happen. It's when somebody's fully asleep.
Right.
You lose muscle tone, all the blood vessels dilate. So it's a little bit more challenging for patients to recover from general anesthesia than it is local anesthesia. The recovery afterwards from fat transfer is 2 weeks of no pressure on the breast of any kind, because those fat cells that have been transplanted and grafted, they're like little seedlings. They just need as much energy and calm environment to survive. So no pressure on the breast, no wearing a bra, sleeping on your back, and no vigorous exercise for 2 weeks. And then after that, you can progressively return back to regular life. Apart from the exercise, though, you can resume your normal activities the next day. There's no limitations for how you move your arms and things like that. You just have to be careful. No pressure on the breasts, and absolutely no smoking. With breast implants, it is a larger incision that's usually done. So with fat transfer, it's just a tiny dot. It's all done through a microscope, basically a keyhole entry point. It's about 2 to 3 millimeters, so no big incisions. With implants, it's a larger incision. On the smallest side is usually about 3 to 5 centimeters, but sometimes even larger, depending where the incision is. And because it is a foreign body, it's also extremely important to be mindful of infection. And there are usually restrictions about 2 to 3 weeks about before you can resume your normal activity. Every surgeon has a slightly different protocol, so some will get you back on your feet sooner, but that's kind of the timeline. And in some cases, implant surgery can be done under local anesthesia, but most commonly it's done under general.
That's extremely interesting, both the difference in incision,
Mhm.
the difference in anesthesia, the difference in recovery time. I mean, those are 2 totally different surgeries, with a similar goal and effect in mind. I'm wondering, with the new technology that we have with being able to sort of detect earlier in women if they have things like the BRCA1 or if they are at some sort of risk factor, a lot of women are electing for full mastectomies despite having, no current diagnosis. It's more of a preventative measure.
Mhm.
Do you see a lot of those patients in your practice?
More and more
Yeah.
and more patients who are either diagnosed with BRCA, the gene that has a high incidence of breast cancer, or have a strong family history, are getting
Mhm.
screening earlier and earlier. And more women are concerned about getting implants after a mastectomy for concern about what the implants might do. So there's more and more patients in my practice that are choosing not to do a full reconstruction with implants and looking to do reconstruction with fat. Now, I will say the one setting where I think implants still have a place, and it's a very different discussion, is women who've had breast cancer. Um, it's very different to consider reconstruction with an implant versus a primary augmentation with an implant.
Okay.
The biology is still the same in that the body will still form a capsule and still have a foreign body reaction around it. I think the context and the desire and the decision to choose the implant is completely different, and that's something worth noting. So, anyone who's had reconstruction after cancer with an implant, it's not that it's not the same process that you go through as choosing an implant for a primary augmentation. It's much more about restoring that which the cancer had taken away, which is that feeling of femininity and form and autonomy around that whole process. So just want to make that point that it is a very different process. Now, as it relates to um, what are the options and how's the paradigm shifting? So I think more and more women are curious about options after reconstruction, or reconstructive options after cancer that don't involve an implant. And I'm seeing just this morning, I had a few consultations with patients that have had a mastectomy and they don't want an implant, but they want something. And in that setting, it's more challenging to do fat grafting because there's not as much tissue to graft to, but it's still possible. And ultimately, really boils down to every patient's unique in terms of the types of mastectomy they had, if they've had or have not had radiotherapy. Radiotherapy is something that's done after cancer to help eliminate the cancer completely. And what it does is it constricts the tissues. It makes them really scarred. And so fat grafting can actually help in that area because what it does is it softens the tissue. It's like bringing stem cells to the area. So more and more patients are looking for options that don't involve implants after cancer. And those options are using your own tissue. Most commonly, it's something known as free tissue transfer. So that's moving a large part of tissue from one part of the body up to the breast, usually from the abdomen. Or it can also use, patients can also use fat grafting.
We're going to take a quick break to get you a whole bunch of friends.
Do you like Friends?
We have about 80,000 amazing women friends, more than that, in one space that can't wait to cheer you on in your fitness journey.
Whether it's lifting you up, getting you motivated to get to the gym, complimenting your outfit, we have gathered 80,000 of the best women on the planet and put them all in one place for your friendship pleasure.
Honestly, I would just like pull out some of the amazing quotes from the group because, like, you would think groups like this, you're like, I don't know. And I'm telling you, once you enter in the door, the virtual door, because you can do this anywhere, that you will find the most supportive community you have ever known. And it's called Stronger Together by CVG. You can find us on a Facebook group. It's a closed group, women only, and you got to get in there.
Get in there. It's so inspiring. Join us today. Wow, this is I don't know. I guess I'm, like a 90s kid and grew up in, very much a Pamela Anderson, and a lot of my friends were getting implants when they were very young, 19, 20, and that was kind of the last touch point that I had with implants.
Mhm.
So to hear all of these options becoming available and all of the incredible like groundbreaking work that you're doing in this field is just it's really important. I want to hit on something you said because this is just everything. There is so much of a psychological aspect of any cosmetic procedure. Um and you touched on a little bit, that it's totally different doing a augmentation for someone who has had cancer and their reasons. And what are when people come to see you for any cosmetic procedure, what are some of your red flags and green flags for if they are ready and a good candidate for something like a cosmetic procedure?
So there's two, I really see two categories of patients: is patients that want to remove their implants after having had them for a long time, and patients that want to do an augmentation with that. And the approach in terms of what a red flag or a green flag might be are very different in those two patient populations. A red flag, um, so some of the first red flags is timing. If somebody decided today or they heard about something and they want surgery tomorrow, timing's important. It's important to not rush surgical decisions because these are life altering experiences that will dramatically change your shape and appearance and the way that you see yourself. And it's better to have some time to sit with it. So, usually, patients that are seeking explant have been thinking about it for some time. And that's a strong indicator to me that they've had, you know, at least 6 months to a year to think about the process. On average, a patient that comes to see me has been thinking about explant for close to 3 years.
Wow.
And that to me says that they've done some research. I'm always open to patients having second opinions. I think it's really important. It's important to do research and see what's out there. And so the timeline of waiting and looking around is an important kind of indicator, red flag or green flag. If a patient was like, I heard about this today and I want surgery tomorrow, that's generally a red flag and we should pause and slow down a bit. Also, in general, if a patient is looking for uh, multiple surgeries, so um, you know, complications happen, revisions happen. That's a very well-known part of plastic surgery. It's just established. However, once you go past two, three, four, five surgeries for the same area for the same thing, that's usually a sign that no amount of surgery is going to fix what the issue is. And it's important to just pause and take a step back, and at that point to look at the bigger picture and figure out what's bringing somebody back to want to keep operating in an area and not getting the result. So that falls into this bigger category of something we call body dysmorphia. So no matter how much surgery somebody does or how good somebody looks, the way that their brain is wired is that they will always see something that's wrong with that particular area. And that's something to look out for in consultations. That's usually a red flag. Yeah. The last one I'll say is somebody, the intention and reason why somebody does surgery. So if you're, if a patient comes in and says that, I want to do surgery so I can get this job, or so that this person will finally like me, or so I can find a spouse, usually also not the best reasons to be doing surgery, just because surgery, it's surgery. It's not a magic wand. So unfortunately, although it can dramatically increase your confidence and help with certain parts of your life, it's not going to just magically fix certain things.
Oh, well said. If you if you had to assign percentages of how much of a cosmetic surgery is a physical change and how much of it is a mental change, um, how would you answer that?
I'd say it's 50-50. So
Mm.
the reason I took some time to think about that is because we focus so much on the physical side. And it's part of the reason I do the work, or the way I've developed the way I work with patients through a protocol I call surgery as ceremony. So surgery ceremony is a way to help patients adapt their minds to meet their body at the end of surgery. And it involves working with a therapist before their procedure to help prepare what they're going to expect afterwards. And so much of surgery is focused on the physical changes. It's how do I, what kind of foods do I eat? How do I prepare my body beforehand? How do I avoid certain things to prevent complications afterwards? What should I be eating or doing afterwards? But the reality is the preparing the mind is just as important as preparing the body. And uh, there's a plastic surgeon in the 60s who wrote a book called Psychocybernetic, which is focused on the framework of the mind. And if you have a positive mental attitude, you're that much more likely to have a good outcome after surgery. So I'd say it's 50-50.
Honestly, there are, not there are many people in the field of, cosmetic surgery. There are far less doing the kind of intense work with patients that and on the groundbreaking technology that you are doing, but there's even less that are offering surgery as a ceremony. I just want to reiterate the fact that we're talking about talk therapy with regards to preparing you for what surgery can and cannot do. And
Mhm.
I just think that that is just such a pause moment because I you're doing the thing. I mean, is that not everything?
Thank you for seeing it and hearing it. I think it's the most whole person way, or holistic way to take care of people as they go through surgery. It's really honoring and like do no harm, take care of people from the start to finish, and what it's about. For me, it's always an evolution. I think there's always more to do and doing it better. So it was created out of a sort of evolution of the process of trying to figure out the best way to take care of people, and that's just just the obvious. Surgery is stressful, so why not deal with the stressful part of it? It's not just about giving somebody a medication so they can feel better. Let's talk about what's stressful about the surgery. It's the noise, it's the sounds, it's the fear of what happens before. It's the fear of, am I going to like my results? Am I going to be happy with the outcome? Is there going to be a complication? So it's all of those things, and it's about talking about that.
I'm just blown away by, I think everybody hopes to be cared for by a physician that is working from, the ground up on literally like taking care of the whole person. And I think that there's not only so refreshing in the medical field, but it's so refreshing specifically in the cosmetic field. It's just you're just doing some really, really amazing things. Um, I want to talk to you for a second about expectations because we have an environment and we are surrounded by sometimes more and more unrealistic expectations of what people look like, what AI people look like. We don't even know the difference anymore.
Yeah.
Is that a real person? Is that not a real person? Um, are people that you're seeing struggling in any way with the fact that the expectations of what women in particular should, I'm air bunnying, should look like, um, and how they may not be fitting into that mold.
Mm. Yeah, it's
It's
really
tough
hard
out there.
nowadays. It's tough out there, partly because it's a question of how much exposure we get to things that shape our mind. And so, in the 80s and 90s, people would be comparing themselves to the hottest celebrity or the latest magazine cover or maybe their most attractive friend. There weren't that many sources. The internet wasn't as big and popular. Like, the things that you'd be seeing that would stimulate your brain probably, I don't know, maybe on the order of 20 to 100 times a day, between the people you talk to and things you'd see. So, how many
The
times
good
have you
old
seen
days.
advertising of some sort that was going to impact you? Now, between AI and social media, it's probably hundreds, if not maybe close to thousands times a day. Like, imagine just driving down the street, the number of times you interact with everything from the people you see to the billboards to every time you open your phone. So just the hit rate of getting hit with
Yeah.
messaging has probably 10x in the past few decades. And then, so not only is the frequency of the messaging increasing about what is and is not beautiful or what you should or should not think about yourself, the nature and the content of it has also dramatically changed, which is you're no longer comparing yourself to, uh, you know, what society thinks is objectively beautiful as a movie star or a model. You're now comparing yourself to a filter, which is the most artificial, impossible version of yourself, right? So, I mean, we've all been there. We all turn on a filter like, wow, that looks incredible, or oh, that looks crazy. But still, it's a very altered version of you, which is in most ways unattainable. I've had patients come in before saying, I want to look like this. And the number of times that they're showing me
Is it a filtered version of themselves?
it's either a filter or somebody on Instagram that's been dramatically altered. And sometimes if you look close enough, you can see it.
Yep.
And I ask my patients all the time, it's really important. I say, please send me inspo pics. It's super important. Not so I know, not, it serves a few functions. One is the purpose of a consultation is to make sure that you're telling me you want this and I can deliver this. Because if you're
Right.
telling me you want this and I'm like, I can get there, probably not a good fit. So the purpose of a consultation is to make sure we're on the same page. The And the reason inspo pics are helpful is because it helps me understand is like, okay, what is it that you're looking for? Is it a reasonable outcome or is it something that is not attainable with surgery? And so
Right.
often, so many of these pictures are either dramatically altered or it's going to be somebody with the right lighting in a certain position that, you know, over exaggerate. We've all been there. We all know our best angles and we know how to make a picture look good. Like, the lighting could have been better here today. Anyway. But the point being, the frequency of the messaging has dramatically increased, as well as the nature of the content. So much so that it's overwhelming. There's it's not surprising that it's hard to keep up with um, the process of loving yourself because you're just constantly being bombarded with messaging from all directions in such an overwhelming way. So to answer your question, I think it's way harder nowadays to find that sense of self and what is attractive to an individual because there's so much external influence. Um, Probably all the more reason why we should be focusing on things that make us feel good from the inside, and then only really be using surgery as an adjunct to layer on top of that. Yeah.
I you know, I was thinking about the filters and the AI and how that doesn't seem to be slowing. It just seems to be sort of picking up steam when it comes to um, how much someone can be altered and how that will continue to sell.
Mhm.
Um, and I'm thinking about just like sort of trends and things that have come in and out. We had a very large breast fashion trend in the early 90s, and it was just like the biggest you could go, and now you're seeing a lot of explant patients from that error, maybe who are looking to go a little bit smaller. Do you see in your practice with trends changing, do you see like women wanting a more natural look with their breast augmentation or a smaller and can that is that a good goal when it comes to fat grafting? Like that can be a little bit easier to accomplish?
Absolutely. The number of times I've heard patients in the office say things like, and these are women, in their 50s and 60s who've had implants from anywhere from 15 to 20 years. A number of times they said, oh, I just did whatever the surgeon told me to do at the time. I didn't want them this big, but he just put them bigger. Like I hear that all the time. And so the trend at the time, even if it was to go bigger, the women uh, that I see that are coming in are asking for a more natural, smaller shape to the breast. They say, "I don't care if they're smaller. I'm happy. I just want a good shape, and I just don't want these implants anymore." The trend is absolutely going towards smaller shape of the breast. And not using such large implants anymore. So much so that the implant companies have also adapted to this. And as a result, are using smaller and smaller implants, which I think is ironic at the same time because of those implants being the same implant and you can achieve it easily with fat. So
Tell
I'll show you for
me
example. This is a
okay.
200 cc implant.
Okay.
I'd say kind of moderate size. It's not that large. Um, this is absolutely a volume augmentation that you could get with fat.
That much.
Yeah. Oh yeah. With one, probably 2 rounds of fat grafting, you could absolutely get this volume. And so, just to explain for anyone who's never seen an implant before, this is a Mentor implant, one of the breast implant companies. It's got a silicone shell and it's filled with cohesive gel on the inside.
Okay.
This is the only time I ever play with implants anymore, is when I'm talking about them or removing them. I'm never putting them in. I say
I
it all
bet
the
they don't
time.
look like that on upon removal.
No, it's pretty scary. They're covered in a capsule, usually calcified and hard. The reason I'm showing this is one, so you can kind of appreciate the size volume of this. 200 cc's is a little bit less than a can of soda.
Okay.
330 cc's is the size of a can of soda. There's this trend about this really pretty ridiculous. It's called ballerina boobs. So marketing and plastic surgery is always finding a way to market the latest thing. And ballerina boobs is this idea of putting a very small implant, so half the size, 100 cc's, to create a small augmentation, which I think is really ridiculous. It's easily achievable with that, and you could safely save somebody having to undergo multiple surgeries as well as the complications of an implant to avoid a 100 cc implant.
Wow.
So although the trend is towards smaller and smaller implants or smaller and smaller volume augmentation, the use of implants is still pretty common. And the breast implant companies are creating, they have these smaller implants and they're advertising them in ways. The the Motiva implant is the latest one, which is meant to be a very small, can be a smaller size implant that is supposedly safer, still made of silicone. Body's still going to have the same reaction to it and is placed in a less traumatic way. But ultimately, placing a small implant is not necessary if you have enough fat. You can easily use the fat that you have in your body to achieve the look of a small implant.
So we're just moving it.
Mhm.
We're moving it from one place to
Yeah,
a different
yeah.
place, and
That's
but
only a
it's
problem if
yours.
it's, yeah, fat. It's your tissue and you're taking it from one part of the body and moving it somewhere else. So, yeah, and you can
And
collect
that's
small
why
amounts of
there's
fat.
no immune response. Is
Correct.
that correct?
It's your own tissue.
So you can achieve that look
Mhm.
simply with your own tissue. But that wouldn't then there wouldn't really be a company to sell implants.
Yeah, of course not.
So
It's not in any implant. So, you know, one of the implant companies, Sientra, they went under, meaning they went bankrupt, but they did start developing fat grafting technologies to um, to improve the viability and survival of fat. But the truth is, um, you know, companies in the aesthetic industry space or any medical device space, they have to have a device to sell.
yeah.
So Full disclosure, I'm not funded by any of these companies, but I use medical devices all the time. I have to use a device to harvest the fat. I have to use devices to put the fat back in. I'm very strict though. I don't use any kind of devices that leave a foreign body, so any implants or anything like that in the body.
Okay.
But ultimately, there is a financial bottom line, and that is something important to think about in terms of how research is done and who's funding it. Implant companies have a very strong incentive for people to continue using them, um, and less so unless they start investing in fat grafting technology. But fat grafting is, for the time being, doesn't require any heavy, extensive hardware, more so than it's been available for decades.
Hey, you.
Thanks for getting in touch with the Thick Thighs Save Lives podcast.
We love your questions and adore hearing from you.
Leave us a hello,
A burning question,
feedback.
or anything else you want to share with us on the podcast.
We will play your message live on air if we can.
Thanks for being an amazing friend. Stay safe and moving.
Tell me, I know that you've helped thousands of women to both achieve an aesthetic result that makes them feel more like them. And you've also helped thousands of women to feel not sick anymore.
Yeah.
And I want to hear from you just about like somebody who stands out in your mind that came to you with maybe some really debilitating symptoms, what you were able to accomplish, and what her final result was.
Um, so I have one patient that comes to mind, but before that, I think it is important to note, we've talked about some of the complications around implants, and if you have an implant and you feel like it's making you sick, the medicine behind the process is still very important, which is it's extremely important to know that breast implant illness is still considered a diagnosis of exclusion. What that means is everything else has been ruled out. So there are other things that can cause those symptoms, and it's important
Okay.
to make sure that you work with a doctor to make sure that there's not something else causing it and not necessarily choosing implants as the first thing that could be causing it. In many situations, when I take care of women who've had implants and they feel like they're making them sick, removing them in an overwhelming majority improves the symptoms, about 70 to 80%. But there are some women who, even despite removing the implant, don't always feel like they've made a full recovery and still have some of the symptoms. Now, that means one of two things. That means the residual effects of the implant, which is the inflammation and whatever the silicone has gotten into the body, could still be causing problems, or that there was an underlying other issues that were also contributing to it. So that's just, I think
Okay.
it's an important sort of medical disclaimer to make, which is
Yes.
implants are absolutely contributing to these problems, but removing them doesn't always solve it. Now, one patient that particularly comes to mind, she was really, really suffered from her implants. Uh, she'd had 3 implant surgeries. She had developed capsular contracture, had to have the implants removed, revised, and then the surgeon placed a mesh. So a mesh is usually what's considered a dissolvable material that's placed to support the breast implant. And that's the thing, these breast implants just cause continual problems. You wouldn't need to place a mesh if there wasn't an implant there in the first place. So it's kind of like that story of the old lady who swallowed a fly. You got to do one thing after another to do the other
Yeah.
to keep up with it. So the only reason that mesh was being placed is because the implant was there in the first place, causing the dropping the tissue. So anyway, she comes to see me, and this woman, she's a police officer, obviously a total badass in her field. She's out there all day fighting crime, doing the thing. And she was in the field. It wasn't not like a desk job. And she developed this really serious pain and difficulty around her implant, and also started to feel some of the symptoms that she thought. She developed a rash and some thyroid issues. So really was starting to be concerned that her implants were causing these problems. And the surgery. So the reason she stands out is twofold. One, seeing her transition emotionally, physically after the implants were removed, but also surgically, the challenges of the procedure. Because what the mesh did is it created a lot of adhesion, so completely destroyed the tissue in the bottom half of her breast. It was as though like it just didn't exist there. We had to fully remove it, and she was embarrassed to get undressed in front of her husband. They hadn't been intimate in months or even years, and the rash that she developed was really problematic. It was like all over the lower half of her body. She thought it was related to the implants. When I did the explant procedure to remove the implant, I could see that most of the mesh hadn't dissolved. It was still there. So not only did she have a foreign body reaction for the implant, it was now the mesh that was causing the problems. So it was just one thing after another. So uh, it was a long procedure, about 4.5, 5 hours, to remove everything, to remove the capsule, to remove all the mesh, to make sure everything was out, and then to do a breast lift. Um, the thing that really stood out to me was when she came in for her follow-up, even a week later, it was a different person. Even somebody that's used to, really high stress situations and like being out in the field, fighting crime as a police officer, you could just tell that she was lighter. When she first came in, she was, it felt heavy. She was sad. She was just really overwhelmed with a lot of the things she was feeling. And then she just walked into her follow up with this lightness about her. And you could just see it was a different person. So that really stood out to me, that she just really let go of the past by letting go of the implants and everything, but also how happy she was with the outcome. We were able to give her her natural form back, and she was able to feel comfortable wearing the police vest afterwards. So I think it was a really dramatic, significant change, and that always stands out to me because it's not just about the physical changes; it's about how comfortable she felt afterwards, and just the sense of relief, literally a weight off her chest.
Literally. I can't. That's just the most rewarding, and I'm a little jelly that you get to have that level of reward in your job because that is just, I mean, talk about, making your day when you see her come in.
Yeah.
Um, one more thing that I wanted to ask you, because I know that we have some women out there thinking that it's possible that their breast implants are causing some adverse symptoms. And
Mhm.
also hearing you say that no matter what the material, your body is having an autoimmune response to an implant being placed there. There is going to be some inflammation. And we sort of know inflammation as, a precursor often to other problems. Um, if someone is saying to themselves, "Ugh, maybe I should get these out," but then very next thought that pops into their head is, "Oh my god, I will have wasted a ton of money 2 times
Mhm.
because I put them in and then I won't get them out." And then also, how could I can't imagine, my body without these. What would you say to someone who was sort of in that conundrum?
Mm. Most patients that go through explant face that exact scenario,
Yeah.
which is it depends where they're at on the journey of wanting to remove the implants. If it just started popping into the head, like into their field of view and the information they're receiving recently, then it's going to take some time because, it is a big adjustment to think about living with smaller breasts, different size clothing, changing your
Yeah.
wardrobe. How are people going to see me, or how are you going to see yourself? These are all important things to think about and take time with. So the first thing is I would say is it's important to just pause and take some time. This is not a decision to rush into. And once you've taken some time, and that time also includes doing research. So it's important if you are seriously considering it, it's good to do multiple consultations just to understand what the options are, what the potential outcome of an explant would look like. First, and to get multiple opinions, it's helpful because you're more likely going to get the honest truth from multiple consults. The truth is going to fall somewhere between there. Nobody's going to be 100% right 100% of the time. And I tell my patients this all the time: this is my best guess. This is what I think is going to happen, but I can't say for sure. Um, but getting more information, getting more educated on potential risks, on the outcomes, and what can happen is a helpful way because you're planting a stake in the future of saying this is what the future outcome looks like, and if I'm ready to go there. And it's rare, but sometimes patients get an explant, and even still after all that, will opt to put an implant back because they just were not ready for what their transformation would look like. And
Yeah.
that's an important part of it, why I think it's also important to have a lot of support psychologically and emotionally, because it is such a dramatic change. It's really meeting a new version of yourself. And for many women, the version of themselves that chose to get the implants in the first place, it's not something to criticize or judge. You're just making the best informed decision at the time with the info you had. But it may not serve you anymore. And that's also fine. But to just not to carry or hold a lot of judgment around it. It's just the process. Of course, thinking about recovery and the financial aspect of things, like it's 2 surgeries and this, it's significant. So that's why taking the time, having somebody who would act as a good guide. There's actually amazing explant advocates out there now that work with patients to just provide information. They also, for the most part, as long as an explant advocate, I've worked with a few. They're not partial to any one surgeon, which I think is the most ethical way to do it.
Mhm.
These are women that have gone through the process themselves, have really studied and understand the ins and outs and the nuances of the explant process. And because they're not particularly working or tied to one surgeon, they're able to speak openly about it, about their
Mhm.
experience. So I think that's really helpful to have patients have a person like that as a guide outside of talking to a surgeon.
Give us an idea of your best resources. Like, where could our listeners see and hear and get in touch with you, see your work? What are some good research places to start if people are thinking about this?
So if you'd like to learn more about me and the work that I do, you can always check me out on Instagram. That's drjon.k, drjon.k on Instagram. And my website, where I share a lot more information, is Aura Aesthetica. That's AURA, Aesthetica, AESTHICA.com, auraesthetica.com. But there are so many resources out there to learn about both fat grafting and breast implant illness or breast explant. Um, there are a number of Facebook groups that are really helpful that provide patients information resources, and you can hear firsthand from other patients. I think the breastimplant.illness.org is a great one. There's some good resources and materials out there. There's also an organization called BISA, Breast Implant Safety Alliance, BISA, and they have it's a nonprofit that is also providing a lot of resources and information to women. And two of the explant advocates that I've worked with that are great. One is Candace Barkley, or on Instagram is Elasticoli Life. She's great, provides a lot of great information, and I've actually learned a lot from her also, just and in the work that she's done with explant patients. Andy Liu is also great. She's written a book called Treasure Chest to talk about the movement of explant as well as her own personal journey with explant.
We are going to link all of that in the show notes so it will be easy access to anyone who wants to get in touch. If you want to get in touch with Dr. Jon, if you want to see his work, if you want to explore any of those resources, they will all be available to you. Um, this has been so amazing. I just want to sit in the incredible work that you are doing and just the knowledge that there is this other option that doesn't involve a foreign body is just, and there are people doing it. Dr. Jon is doing it, and it's really, really hopeful in this kind of journey that women have been having. Um, I just want to thank you so much for coming on. It was truly so eye-opening.
Yeah, thank you, Rachel. Thank you for having a platform for it and to share it and to help spread the message. I appreciate you.
Awesome. Awesome. It's been so wonderful to speak to you. And I really am wanting our listeners to get in touch with you and to use all your resources so they can be the happiest, healthiest version of themselves. Thank you so much for being here.
Awesome. My pleasure. Thank you.